U of T Dentistry Alumni and Friends webinar. I'm Selina Esteves, Director of Advancement for the University of Toronto's Faculty of Dentistry. Unfortunately, Lynn Tompkins is unable to be on the call tonight as planned. So it's my honor to step in to moderate the discussion with this distinguished panel on behalf of the faculty. Some housekeeping notes just before I introduce our speakers for this evening. After the event, you will receive a post-event survey asking for your feedback. Please provide your honest feedback as it allows us to provide you with interesting and engaging programming. We thank you so much for taking time to fill out those surveys. Throughout the event, you can send in questions using the Q&A function. At the end of the discussion, we'll have the opportunity to answer some questions from the audience. We expect to be wrapped up in about an hour, but we may go over just a little bit by about 15 minutes to allow for questions if we see the need to do so. So with us tonight, we have our four panelists: Lesli Hapak, President of the Ontario Dental Association; Daniel Faulkner, Registrar and CEO of the Royal College of Dental Surgeons of Ontario; LouAnn Visconti, CDA Board Member; and David Stevenson, Chair of the ODA Pandemic Recovery Working Group. I'm just going to say a few words about each of these wonderful members. Dr. Hapak graduated from the School of Dentistry at the University of Western Ontario. In 1994, she obtained a diploma in periodontics from the Faculty of Dentistry at U of T. Dr. Hapak has operated in private practice in periodontology since 1994. In 2006, she was the president of the Ontario Society of Periodontics. She has also held numerous roles at the ODA, most recently, of course, as their president. Dr. Stevenson received his DDS from the Faculty of Dentistry at the University of Toronto in 1986, and upon graduation served 4 years as a dentist in the Canadian Forces. He's volunteered at the ODA since 1993, serving on numerous ODA committees and task forces. In 2011, he was elected to the ODA Board of Directors, and in this capacity has contributed to the shared initiatives with the Canadian Dental Association. Dr. Visconti received her DDS from the Faculty of Dentistry at the University of Toronto in 1998. In 1988, sorry, LouAnn, I knew that hit my eye wrong.
No, I think that's great. It makes me
I was going to say you wish. I'm sorry, because I jumped ahead. In 1992, she graduated from the University of Manitoba with her orthodontic specialty certification and Masters of Science. For over the past 25 years, she has been involved with the ODA, serving on several advisory committees and task forces. She is currently serving as the Ontario Dental Association representative to the Canadian Dental Association Board. And finally, Mr. Faulkner is a recognized regulatory leader with over 25 years of experience in healthcare and professional regulation. His career spans all aspects of regulatory program oversight, including practice-based assessments, quality improvement, national license, oh my goodness, we're moving on, and professional ability, and practice risk-based solutions informed by evidence. He is committed to regulatory excellence that is informed by data and evidence, proportional risk of harm, and accountable and transparent to the public and stakeholders. Welcome all of you. That was a mouthful. I think basically we're done the webinar at this point, but I really do appreciate you all for being here. Let's get started. So our first question is actually to all of you, and it's really around what the top 3 things the ODA, the CDA, and the RCDSO advocated for in the early days of the pandemic. Maybe I'll kick it off to maybe I'll kick it off to Lesli to start us off.
Sure, Selina, thanks. Well, I guess with 3 things, from the ODA perspective, I guess number 1, the most pressing issue for dentists right from the start of the pandemic has been getting access to personal protective equipment, or what people know now as PPE. When dental offices were shut down last year for 3 months, from March until June, many of the dentists in Ontario donated our PPE to frontline workers and our colleagues that were able to stay open and provide emergency dental work. So I guess once it became really evident that there was a global shortage of PPE, we started to lobby the provincial government very aggressively on getting access to provincial stockpiles of PPE, stating that like dentists and our teams are essential healthcare providers, since we can provide appropriate dental care to keep people out of going to emergency departments for dental related issues. I think, which we all know, taxes our healthcare system. So that advocacy worked, because as of last September, the provincial government did recognize dentists here as essential partners in the fight against COVID-19. And we can get access to provincial stockpiles of PPE if certain criteria are met. So I guess that's number one. Number two, I guess would build on something that I said with number one, and that is we've really advocated right from the beginning that dentists are essential healthcare providers, not just essential partners in the fight against COVID-19. And this advocacy really ramped up last fall when we learned that when we learned Canada approved the vaccine to come into our country. So we sent letters to the Minister of Health, the Premier, and we were really vocal in the media. And I guess that advocacy also worked because in January, we learned that dentistry was included in the province's list of healthcare workers, which would receive early access to COVID-19 vaccine. And last, I mean, the ODA has done a lot of advocacy, but I guess the third topic or the third issue in terms of advocacy that I would say is that the ODA has been advocating to the public that dentists are leaders in infection prevention and control right from the beginning. And since community-based dental offices were allowed to open back up last June, we've enhanced those protocols so that we could provide a safe and sustainable and accessible work environment. We're consistently in the media informing the public what to expect when they come to a dental office, and really trying to get the message out that one's dental health does affect your overall health. So you shouldn't avoid going to the dental office, especially if you have a dental issue. So I guess those are the three things that the ODA has been advocating for since the beginning of the pandemic.
Great. Thank you. It's lots to think about, and I think probably crosses some, boundaries as well. LouAnn, do you want to add a little bit to that, or let us know what the CDA has been doing?
Was really pivotal in coordinating the national response to the COVID-19 pandemic through facilitating weekly meetings of its members, sharing information, but also obtaining feedback on the impact in the different provinces across and territories across the country. And another key role that the CDA plays is in the analysis of data and in studying the trends that could impact the dental profession before they occur, from information gained through its international contacts, as well as from a national CDA commission survey to study public attitudes towards oral health care. So the advocacy asks of the CDA are in response really to both the predicted impacts of the pandemic on the dental profession, as well as on the feedback from the provinces and territories. The main concerns, of course, at the beginning of the pandemic were to get dental offices reopened safely so that further interruption of vital dental services did not occur. So with this in mind, the top three advocacy asks of the CDA at the beginning of the pandemic were, not unlike ODA, our first one was the creation of a national PPE strategy that recognizes dentists as essential healthcare workers when considering the distribution of federal reserves of PPE to the provinces. Secondly, access to care for Canadians through facilitating access to employee health benefits by seeking ways in which to encourage more employers to offer or provide dental health benefits to their employees. And thirdly, to provide a targeted envelope of federal health transfer dollars to be earmarked for the provinces to put towards investing in their provincial dental programs further addressing the growing gap in access to regular dental care for Canadians.
Wow, that's awesome. Thanks, LouAnn. Dan, just with the RCDO's view, I mean, which comes at things from a different angle, maybe you can jump in here as well.
Yeah, thanks, Selina. I will take a little bit of a different view on this because the RCDSO is not an organization that advocates for the profession. Our mandate is pretty simple. It's defined in the legislation, and it's one sentence, I often say, to serve and protect the public interest. And so when I think about advocacy, I think about it more generally. Sometimes it involves relationships with government. I try to think of it in terms of advancing a course of action or advancing something that's going to further an organization's mandate. And I think this really helped us to kind of focus in the early days of COVID on three areas, probably many more, like others have said, but three areas that RCDSO felt very strongly about. One was that anything that we did to provide guidance to the profession was going to be directed by the science. It was going to be directed by the evidence, recognizing that it wasn't always strong and there was lots that wasn't known, but we did learn over the years, and we've really tried to stick to that principle of planning and implementing our guidance based on the scientific knowledge that exists. We also wanted to make sure that we were as consistent as we could be with the other oral health regulators. And really looking at the guidance that we were all offering, because at the end of the day, it's about the patient. I could say that we were largely successful at that, but we weren't completely successful at that. And there's certainly been a lot of learning and a lot of work that's been happening even in the last month or so to really try to get on the same page with the other colleges that oversee the other professions. And finally, we really tried to advocate for a system that didn't trip all over itself in terms of the local public health units and the complaints that might come into local public health and complaints that might come into the college from members of the public. So we really tried to make sure that we had some strong processes, that we weren't duplicating efforts, and that we were communicating as much as possible. I think COVID represented a really interesting issue for us because it demonstrated that we aren't always at odds with the professional associations. I think had a very strong common interest, and we're compatible in a number of ways in terms of how our guidance was converted into practice tools by the ODA. And so it was and it is a very strong relationship, even though our mandates are quite different. Yeah,
that's great. It's terrific. Thank you. And I have worked with you guys all a little bit, and I know how deeply you all collaborate together. So it's great to hear. Thanks, Dan. David, I'd like to actually hear from you because I know you work on the Pandemic Recovery Working Group from the ODA, and maybe you could just share with the group sort of that group's fundamental principles for making recommendations, like how you base your recommendations. Do you want to share a little bit about that?
Yes, thank you, Selina. And I think it's an excellent to build on what Dan has mentioned as well. You know, right from the get-go, over a year ago when we were formed, our fundamental principles for our group were to make recommendations, to find solutions, or to help folks find solutions that were based on the best available evidence at the time, always prioritizing the safety for our communities, our patients, our staff, and our dentists. Maintaining access to care for everyone, and that's including people on government-funded programs. And then also to maintain sustainability of practices in dentists so that they could get through this. We knew this was going to be a long haul. And as Dan said, although the regulator and associations have separate mandates, there's significant overlap, especially during the pandemic. Much of what is good and safe for the public is good and safe for our profession as well. And there was a lot of uncertainty. And that uncertainty, it does foster a collaboration because we all needed to learn and adapt at breakneck speed. The working group considered its role primarily was to help the decision makers as they set the expectations for our profession, and then in turn to help dentists understand and meet those expectations. And this was especially important when it came to development of the guidelines.
Yeah. Well, and so thanks, David. I might stay with you, David, and just inquire further about how the guidelines, you've seen how the guidelines have affected institutions versus community-based practices. Can you talk a little bit about that?
Yeah, I can certainly speak to the impact that the guidelines have had on the physical differences between institutions and community-based practices. And I can do that because many of those physical distances or differences existed between different community-based practices as well. And I think the big issue here we're talking about is the need for closed operatories during AGPs. All practices required structural modifications to varying degrees, and our ODA surveys from last summer indicated that there was an average spend of about $25,000 or more for individual practices. And you need to also consider the cost of enhanced PPE at a time of significant demand for PPE. But all those issues, they're only amplified when it comes to the impact on the dental school. I mean, it's hard to even fathom. Selina, I see you smiling now. So, but a significant difference comes when you consider the impact on the capacity to function. As Lesli had mentioned earlier, the community-based dental practices as essential healthcare facilities, we were allowed to open, and we've been allowed to stay open through all stages of the pandemic thus far, safely maintaining our access to care. But there are some reductions in care capacities due to structural, time, physical distancing requirements. But those capacities have had far more impact on the school. And I think that came to a head in January when I believe it was the Minister of Colleges and University did not consider dentistry as one of the programs that directly supported the healthcare workforce in response to COVID-19. So significant capacity limits were placed on the dental faculty, and that affected its ability not only to train future dentists, but also to maintain access to care. I believe it's like 10 students per the clinic. And
actually, I'm going to jump in there. The clinic, actually, we've been fortunate because clinic is about clinical care. Where we've gotten stuck at the school largely has been in teaching spaces. So preclinical, it's been a real challenge. I mean, I'm not going to suggest that it hasn't been a challenge with our large open clinics, which everybody remembers. But we've been able to continue. I mean, the dean has actually been very successful. And I think given all of your work in advocacy as well, we've been able to keep our clinics open, but the capacities and the social distancing it's not the same. I mean, you're not chugging 75 people through every clinic at the same time as the would typically do, but we're managing because they've added Saturday clinics, and we're going into the summer, and instead of 2 clinics a day, it's 3. But
you built a satellite clinic too. You built a satellite clinic.
We're in the process, September. So, but sorry, continue.
It's a significant issue, and that's the differences are there, and they're just amplified when it comes to the college. Yeah.
Thanks. Yeah, quite right, and I appreciate it. I think maybe what we can chat about is, what the thought has been given to the dental school and the institutions with the regulations, and sort of that wider system impact potentially. Maybe I'll kick it to you, Dan Faulkner, to start.
Sure. It's I don't think we're really going to appreciate the profound impact that this has had until we get a little bit beyond it and start to look back and reflect on really such dramatic effect on our institutions across all systems. And David's talked, and Selina, you've talked about the dental school and the training capacity limits. Then you need to look beyond that to institutions like the examination boards, not just in dentistry, but the NDEB has certainly been very challenged by this. And I think that some might think, well, I mean, these are exams, they need to be delivered. Why can't they be delivered? And you get into sort of the nature of examinations, and you get into the structure of examinations and the science behind them. And while NDEB and many other professions at their national licensing examination board levels were really thinking progressively about how to make their examinations more virtual, they weren't there yet. And you can't turn that on a dime. So much like the infrastructure at the training schools, you can't turn the examination on a dime either to convert to something else that's going to help to accommodate in this day. So you have things like the space limitations at universities for sites for examinations. You have limitations at hotels or other venues where you might actually populate with a number of students who are challenging the examination. And I know it's been very frustrating for those individuals who have been on the receiving end of cancellations and delays and so on. I really think and I hope that it pushes all of our national examination boards to really look at how we deliver those examinations and to mitigate these sorts of risks that can happen even if a site gets canceled, because in beyond COVID, there might be all sorts of reasons why sites can get canceled at the last minute. And to sort of stick to the theme as my last point around advocacy, this has been a huge issue in Ontario. We have what's called a fairness commissioner who oversees all the regulators in terms of how we license individuals and really looking at how we do this for internationally trained graduates. And so I've spent the better part of the last 2 months really trying to work closely with opening up conversations with our fairness commissioner, our executive director at the NDEB and the Royal College of Dental Surgeons to make sure that there's accurate, timely, relevant information that's being shared, because we want to make sure that there are no issues that come out of the Fairness Commissioner's office that might impact us as a system in a way that's not necessarily helping to move forward. So that's been another part of advocacy that I think should be considered in terms of how we're supporting some of the system issues that have emerged from this.
Yeah, no, I think it's, terrific, Dan. Thank you for that. I know LouAnn and the CDA that you actually have some comments to share in this area.
Yes, thank you. I would like to speak specifically on the logistics behind the dental school admission test, or the DAT. The good news is that dentistry still continues to be a sought after profession, and that was evident in the rapid sellout rate for the fall 2020 sitting of the DAT. But the COVID-19 pandemic really did have a profound impact on the logistics of administering the DAT last fall. The CDA staff had to overcome so many challenges. Things were rapidly changing, and there were COVID-19 related issues to hosting the exam, such as finding facilities that would administer the exam, finding invigilators to invigilate the exam, and working out how to administer the exam in an environment that's safe for the registrants and all involved, while adhering to the COVID-19 restrictions. But the one thing that the CDA has been doing in the last few years, in order to mitigate any risks for the ability to offer the DAT moving forward, we're really moving away from the conventional pen and paper test to a more computer-based format. And this is what allowed the CDA to actually be nimble in its ability to offer the DAT last fall, because we did offer it in a computer-based format. But unfortunately, when you have a computer-based format, you can't offer the manual dexterity test. And this test will likely not be able to be run until the end of the pandemic. But fortunately, the universities that require the manual dexterity test, along with the DAT, have agreed to waive this prerequisite for admission during the pandemic. And, owing to the uncertainty in the number of COVID-19 cases, the first DAT sitting for 2021, which normally is in February, is taking place from May 29th to June 30th. However, we're entering a third wave with the variants of this pandemic. And so there's greater uncertainty that still exists in whether or not the exam will be able to be held in key test locations. The third wave of the pandemic is hitting hard in certain provinces, Ontario being one of them, but also Alberta and BC.
Yeah, thanks, LouAnn. It's good to hear about the technology, right? That blend of allowing you to sort of pivot. It's amazing. Thank you. A lot of what I've just heard too, it owes to the point around safety, right? And so, I'm curious if we can look at the sort of the elephant in the room, what's it look like with respect to seeing cases of COVID-19 in dental practices? And, as part of the recovery group, maybe I'll start off this question with you, David.
All right, thanks, Selina. And I think, starting off, I think this is a bit of a good news story. There's been a tremendous responsibility that's been placed on the profession of dentistry and our community-based practices, and I think we've done very well with that. To the best of my knowledge, at this point, there has been no known confirmed case of COVID-19 transmission related to dental treatment, related to treatment in the operatory. So that is a testament to our protocols. It's a testament to the fact that I feel that dentists are experts at IPAC procedures. We've got good guidelines. But again, I think dentistry started off from a good place. We had this before the pandemic. We were accustomed to going through the proper procedures to prevent infection, whether that be droplet-based infection or respiratory-based infections. That doesn't mean we were perfect at all the time, but we were starting off from a pretty good place. Having said that, we can't be arrogant about it. I think we need to know that, yes, this is a responsibility we have. Yes, we've done very well, but there's public health measures. The general public health measures are so important because there have been cases of transmission within the office itself that's related to the lunchroom, related to administration areas. And so, you can't drop the ball in one area. You have to keep it up. When we look at our guidelines right now, and they involve all forms, the entire range of the infection control protocols, whether it be from the screening process to prevent COVID-19 from coming into our practice, and I can't stress how important that is, to all the way down through administration controls, engineering controls, and even the PPE that we have. So yeah, dentists have been doing a very good job. We have to keep it up, but we can't forget the public health measures as well.
Yeah. So anyway, it's frustrating in some respects to hear how positively we've done, right, with no spread and no cases, and yet the restrictions sometimes feel suffocating. But I understand both sides of that and why that's the case. But yeah, thanks a lot, David. It's good to hear. LouAnn, do you or anybody else, Lesli, anybody have comments on this as well?
Well, I can offer that the CDA is monitoring this through their ongoing contact with the Office of the Chief Dental Officer. And to date, across the country, there have been no known cases of transmission from patient to provider, provider to patient, or provider to provider during treatment. But there have been, as David was talking about, there have been a few cases of staff to staff transmission, and that's a result of not being vigilant in the staff rooms where people are eating, not socially distanced, not wearing masks. In response to this, I will add that the CDA did launch 2 campaigns that really targeted dentists and their office staff. The first campaign took place in August 2020, and it was just creating resources for the dental office. And the messaging was remain vigilant, both within and outside the dental office, maintaining all of your public health precautions inside the dental office with or without patients there. And then the second campaign took place in November, again targeting the dentist and the staff on how to remain vigilant while celebrating the holidays safely in the dental office. So, as David had mentioned earlier, maintaining these precautions and remaining vigilant at all times has, in addition to the stringent IPAC and COVID-19 guidelines, kept dental offices a safe environment for patients and staff. And this in turn has resulted in no further shutdown of dental offices during subsequent lockdowns in Ontario. So I think we're doing something right and that we're allowed to stay open.
Yeah, sounds like it. Dan, do you have a thought on that coming from the public safety side? It sounds like dental offices are safe.
Yeah, I mean, I've been very impressed. I mean, I think the profession has stepped up over the last year. I can say that we haven't been inundated with complaints. There certainly have been some, and there's always some that are going to be very serious that we have to take very seriously and investigate, as is our mandate. But by and large, I think complaints to the public health units have probably been fairly steady. And I think the point about the frustration with the fact that there's been such vigilance, but it's not been recognized. Don't forget that the public recognizes it. I think there's been a tremendous amount of public trust and confidence that's been built through this. And that's a really important feature. I think the public sort of sees itself as part of the accountability chain on this as well. because they're very educated. Obviously, this is something that's affecting everybody's lives and livelihood. And so they know when people aren't wearing masks who should be, or when there's not a partition that's up or a barrier, or when the chairs are too close in the waiting room. And so they report on that. And there's, I think it's all part of the accountability chain that's been built here. And the other part that I think will help to move forward is when we think about the IPAC standards, and if there's a process down the road to really look at those and see what the evidence holds and what we learned from COVID, there's a very important public perspective that we have to bring into that as well, in terms of how we consult with the public and really start to see about how sometimes we may have things that seem to you as practitioners to be overkill, but what does that actually contribute to the trust and the confidence by the public in the profession when they go to their dentist?
Brilliant point, for sure. As someone who is not a practitioner, but I go to my dentist, right? And I have actually noticed, because I've been taking my kids for their cleanings, and I had mine just this week, the difference. I've seen the office change, and the full glass doors are up, HEPA filters are in every operatory. They were 3/4 walls, now they go right to the ceiling. They're obviously all wearing masks and the whole thing. And so it's been interesting for me even just to see the evolution, and it does give me confidence that I'm actually in a really safe place. I'll continue to book. I will bring my kids in because I know everybody's getting, sort of top rate treatment dentally, but also that they are exceptionally safe. So it's great to hear.
Selina, it's funny that you say that, because I have a few nurses that are in the practice that are parents. And when this all started, the first thing they did was when they finally did come in, they said, this is fantastic. And, I feel comfortable now. And, so people do notice. They do notice things for sure.
Yeah, 100%, right? You call before you go in, nobody's in the waiting room. It's all, I know it's been difficult to transition, but this is a frightening thing for everybody, and practitioners who are right in somebody's mouth, but also as the patient, you're nervous about doing the things you used to do. And so understanding that your dentist has taken the necessary precautions to keep you safe and them safe, you feel like, okay, I can actually take care of myself. So it's reassuring. It really is. So speaking about being reassured, we're talking about vaccines. And so I wonder if we can kind of get into why you would advocate for dentists to get the vaccine. Seems obvious, but I want to hear this from you guys, and also about giving the vaccine. I think I'll go to the ODA first and maybe ask Lesli to sort of come back to the conversation and take this on.
Sure. Thanks, Lena. I guess, as I was stating in your first question about what 3 things the ODA advocated for, again, this was one of them, advocating for dentists to receive the vaccine. And I guess the rationale that we've been messaging for that is starts off like early on in the pandemic. Dentistry in Ontario or even across our nation was a profession that has been considered a high risk for our high risk group for transmission of the virus. Due to the nature of the care that we provide, we are at higher risk. We can't social distance when we provide dental care. Our patients must remove their masks. And as David had said, some of our dental procedures that we provide are aerosol generating procedures, which puts us at higher risk of transmission. We absolutely know that your dental health can affect your overall health. So dentists and our teams really need to stay healthy to be able to provide that community-based dental care. And the reason behind that is we want to avoid people going to our emergency departments for dental emergencies and dental issues, which, many times when you go to an emergency department for a dental issue, you're not diagnosed properly. And you're treated with a Band-Aid approach, antibiotic and a painkiller, for example. And during this third wave, we're seeing many areas in the province where the healthcare systems are being completely overwhelmed, and patients are needing to be transferred, unfortunately, outside of their communities to other hospitals because there is no room within their own region. So again, it's really important that the dental team remain healthy to be able to provide that community-based dental care. As I like to say, vaccines don't save lives, vaccinations do. And as a real world time, we're seeing in our own province, in our own country, and other countries that vaccinations minimize severe illness, decrease hospitalizations, and even death that's caused by COVID-19. So that's how we've been really trying to advocate for dentists and our teams, dentistry in general, in terms of getting the vaccine. Now, on Selina, your other question was, or issue with respect to dentists giving vaccines. And I can say this is something that the ODA and a few of our committees have been working on. There are some logistical issues that would need to be addressed before dentists can provide vaccinations. And some of those, for example, are currently administering the vaccine is not within dentist scope of practice in Ontario. There's also storage requirements for some of the vaccines, which would make it very difficult for dentists to administer vaccinations. For example, within a private dental setting, as well as what are the PPE usage that we would need to go through to provide care. Again, for example, within our private dental setting. There are a couple of other provinces that have been given temporary certification to administer the COVID vaccine on a volunteer basis at designated vaccination centers. And I'm sure LouAnn, when she may want to speak to this in a moment as well, to give a bit more detail from a national perspective, and the other couple provinces that have been doing this for a few months already. We do know that an order from the Ministry of Health in Ontario would have to be given to allow for a change of scope. And again, maybe Dan will speak to this from a regulatory perspective. But I guess the only other thing that I guess I would say that on behalf of the ODA, I have written a letter to the Association of Local Public Health Agencies, as well as the Council of Ontario Medical Officers of Health, stating that dentists are willing to continue to support our communities in any way we can to help fight against COVID-19. And that does include administering the vaccine. But as we all know, currently, with the unfortunate lack of supply versus the high demand, right now there are enough certified individuals that can give shots in arms in Ontario. But we do continue to hear from the government that massive doses of vaccines are coming, and we know it will be a daunting task to get as many people vaccinated as possible quickly. So, there is potential for more hands on deck to help, and dentists are willing to do so if need be. But again, our primary advocacy all along, right from the get-go, was to get dentists and our teams in Ontario eligible to receive the vaccine in that first phase of the rollout.
Thanks, Lesli. Yeah, LouAnn, I'd be interested in the sort of the national approach on these 2 points as well, if you could talk to that for the CDA.
Sure. I just wanted to say, going back to one of the key roles that the CDA plays, and I was talking about the predictive value, to be able to predict impacts that could impact the dental profession before they occur. This was another one. I mean, through our international contacts, the CDA predicted early on the disparity between the supply and the demand of the vaccine. And so this allowed them to inform the leadership of the provincial and territorial dental associations to, really start advocating early on for prioritization of dentists to receive the vaccine. And the CDA has worked with each of the provincial and territorial dental associations, customizing letters to their ministries of health regarding dentistry as an essential service, particularly when it comes to being considered for early receipt of the vaccine. And every province and territory had actually lobbied their governments for this, but with differing degrees of success. And I will say kudos to the ODA. They did a fantastic job. The government listened, and we were in the very high priority category. So we were in the first wave of vaccinations with other healthcare workers. But you have other provinces like Newfoundland, and they were not even included in their vaccination rollout in their province. And I think as of Tuesday, we were hearing that they were just receiving, some of them were just receiving their first vaccination. In Alberta, some dentists received it, but not because they were dentists. It was related to other age and health risk factors. And in PEI, the dentists last week finally received their first vaccine. With respect to the second question about the vaccines, as far as dentists as vaccinators, we know that across the country, dentists were not just rolling up their sleeves to receive the vaccine, but in Alberta, Manitoba, BC, and Quebec, they lobbied their provincial government and to join in the fight against the COVID-19 pandemic. And so they were able to be considered as vaccinators. And this required online courses and I believe in-person training, probably up to about 10 hours to be certified. And once they were certified, they were giving vaccines in government-run clinics. So, they're in the three provinces. I know that in BC, they were talking about, again, there was, many dentists have signed up and are certified, but are not currently giving the vaccines, again, because of the supply of the vaccine not being present. So that's what's happening nationally.
Thanks, LouAnn. Anybody have further comments on that? Dan, did you have any?
Sure.
Yeah.
Yeah, I won't repeat a lot of what's been said. I think vaccination is one of those tricky issues because it's a huge public interest issue. And you would think, well, is that the RCDSO's job then as a public interest organization? And I think that, it's one of those issues that there are lots of people in need of vaccines, and there are other organizations that are advocating for dentists, and our role is not to do that in terms of who gets it when. And so we haven't been active, obviously, on that front in terms of advocating for who should be top tier, front of the line. But I think the flip side to that is the vaccination issue in terms of delivery and administration. And again, we don't see ourselves as being the advocate for that, but I've been very clear in talking to different groups in the government that we're not going to stand in the way. And so when you look across the country and other provinces are utilizing dentists as part of that delivery, we will certainly support whatever training or guidance that might be needed from the RCDSO to support that happening. And I think the government has made some decisions on those directives and where they will go for capacity building right now. And they're focusing on pharmacists and pharmacists in training and nurses, a broader group of nurses. There are ways to do it without an emergency regulation or directive. And that's typically what's happened in other provinces. You have to get some kind of regulation from the government to allow for it. Similarly in Ontario, but we also work under a delegation model. And so it is kind of clunky. It's not the most efficient way, but there can be ways that dentists can be involved in this as long as there is a delegating authority or a delegating physician, for example, who takes responsibility for the training of that individual and the work that they do with supervision. So there are ways to do it. And again, RCDSO is, I think, in a position to facilitate some of that, but not necessarily actively lobby or advocate for it.
Yeah, it's interesting. I mean, you've sort of, thanks, Dan. You've sort of answered part of what we were going to ask in the next question, which was around sort of the evidence as to why you would advocate, which again, some of this seems obvious for getting the vaccine and also ensuring or positioning dentists as being able to be vaccinators. I'll send that out to the group to see if anybody has some commentary on it. Maybe I think, David, you might have a few things to talk about with respect to the precautionary principle again.
Yeah, and thank you, Selina. I think that's important to note because, you know, I've earlier in the webinar we've talked about how safe dental practices are and how they have not been sources of transmission. And so I think it's a very legitimate question to say, so where's the priority? Why the priority access to the vaccine? And I think it's important for folks to know that we did not ask to be the highest priority. We asked to be the very high priority. And with very good reason. When you look at the highest priority, those were institutions or settings that were actually dealing and treating with active COVID patients. You know, a long-term care facility, when someone gets COVID, you can't say, well, we'll come back and see you in 2 weeks when you clear the screening test. You know, you have to treat them. So these were professions and these were healthcare workers that were actually dealing with positive COVID patients. Whereas dentistry, again, I alluded to earlier how important the screening process was to that. We are to limit treatment of people who screen positive to emergency and urgent care only, and we can send them away and say, come back in 2 weeks. But nonetheless, we are dealing with at-risk procedures, and there is not the evidence, and there may never be the exact evidence, but this relates to the precautionary principle. And we've heard of the precautionary principle throughout this pandemic. You've heard of the vaccines being the guidance on the vaccines being altered due to an abundance of precautions. Well, the precautionary principle is essentially that public health measures to reduce risk before the need of scientific confirmation, because you don't always get it. But nonetheless, in times of very high community spread, dentistry is a surgical profession. We are dealing with aerosols. The chance of dealing with an aerosol in an asymptomatic patient are greater. So that's where that priority. That's why we're not the highest priority, but the very high priority. So the evidence does lend itself to substantiate that. And historically, and when I say dentists, I mean all dental professionals, assistants, hygienists, and dentists as well. So I think that's important evidence to know that we use the precautionary principle throughout guidance, throughout public health measures in this pandemic. And that principle was used in determining where dental professionals fit in the priority scheme for vaccination.
Yeah, thanks. Thank you so much for that clarification. So interesting. LouAnn, and I think LouAnn has things to say just sort of from that wider perspective, and then Lesli or Dan jump in at any point as well.
Great, thank you. Really, I mean, until the world is vaccinated, there's going to be pockets of infection. And where you have areas of unvaccinated populations, the virus will spread. And as it does, it's just constantly replicating and making copies of itself. And this is when changes can occur. They're known as mutations. And when a virus has one or more of these mutations, it becomes a variant of the original virus. So one thing I think that, and David, I think has either brought this up or alluded to it, vaccines are not the silver bullet to the current pandemic. Receiving the vaccination doesn't mean we have to throw our precautionary health safety measures to the wind. In order to prevent the pandemic from spreading and variants of concern from emerging, you really have to, there has to be containment of the virus. And, that's through testing and contact tracing, as well as isolation and quarantine. We have to mitigate the virus by hand hygiene, mask wearing, social distancing. And finally, there's the vaccine, which imparts herd immunity. So really, all of these things must work together to save lives and stop the spread of this virus. So I think that that's really important to point out here as well. And I will add, that just a little plug for the Canadian Dental Association. In order to assist dentists to have conversations with their staff and their patients, the CDA has an excellent resource, and it provides answers to the most commonly asked questions about the vaccine, as well as dispelling the top 10 myths of the COVID-19 vaccine. And that can be accessed through adc.ca. It's a very good resource if anybody wants to look at it.
Thanks, LouAnn. And sorry, just another housekeeping thing. When we send out the survey after this, we can add in some of these links and resources as well, so people can, of course, sort of read further if they'd like. Before we move on, Leslie or Dan want to comment on this?
No, I think David, as chair of our pandemic recovery working group, gave a really good perspective on answering that question. So
Great.
Nothing to say at this point on that.
No problem. No problem. Dan, do you have anything further?
No, that's fine.
No, you're good.
Yeah.
Okay, terrific. Sorry, if you were shaking your head, you know, this is the beauty and the curse of virtual is I only have a tiny thumbnail, and so I can't see everybody at the same time. So, okay, I'm going to put my faculty hat on a little bit and my director of alumni and engagement. And I'm thinking of our students and our grad students and, you know, going out into the profession at a time of flux, you know, what can DDS4 and specialty program grads sort of expect, and what can you do or what have you been doing with the mindset to support these new grads as they are about to go out into the profession? Maybe LouAnn, I'll kick it to you for national perspective on this.
Sure, thank you. Well, all I can say is that it's certainly a much different environment than when I graduated back in 1988. But different it doesn't mean it's bad. There's so many exciting opportunities and many different career paths to consider as a new dentist. The CDA definitely wants to help new dentists realize everything that's available to them. So in this regard, the CDA has developed some resources. There was the article in the CDA Essential publication, and it was entitled Starting a Dental Career During COVID-19. And this article recaptured the highlights of an online panel discussion that was organized by the Federation of Canadian Dental Student Associations, where experienced dentists answered questions that were posed by dental students about the challenges of starting a dental career during the COVID-19 pandemic. Another resource that the CDA has developed is the micro website, Dental Career Options. And this is an excellent resource to assist new dentists in fully understanding what all their career options are and what's available to them. And the type of information that you'll expect to see on this website, this is dentalcareeroptions.ca. The information ranges from, that on traditional associateships to corporate and group practice associateships. It also has information on choosing a residency program, a specialty program, or information on becoming a practice owner. And the other thing that this website does provide is more resources that you can look at for more information. So in that way, the CDA is really trying to, help new grads and new dentists, chart the future of their dental career.
Thanks, LouAnn. Great to have those resources. And again, we can also add some of these links as well. Yeah. Leslie, the ODA must have a perspective on this.
Oh, I do, but I saw Dan just put up his hand. So I think he may have something to add to maybe say to.
That's okay. I'm whatever order you want to go in, but my mic's on. So
go, Dan.
Yeah, what I'm about to say is something that I have thought about for a while, and it doesn't just apply to new dentists. It could apply to any new member of a health profession that's being launched into their practice. And we've been through and are still going through such a profound and prolonged disruption to our lives and to training of those in fourth year and those in specialty training programs. And I think it's really important to appreciate, and LouAnn, I think you were getting at this in terms of the resources that are available. What a shift, what a dramatic shift for someone to go from a supervised setting to an unsupervised setting. And how do we start to think about the support that's needed for those individuals who are launched into practice? And I'm thinking beyond the kinds of resources that they can tap into and read about and maybe go and talk to others. I'm thinking more about what sort of supports or systems do we set up that allow for much greater peer interaction, much greater mentorship that's available in the kind of practice environments or practice models that I think are typified in dentistry. And a guru in medical education talks a lot about self-assessment, and I think I won't quote it exactly, but one of the messages that I've taken from his work is, if you really want to self-assess and develop, find somebody who will tell you exactly what you need to hear. They're not afraid to tell you what you're doing well and what you're not, because if you respect that person, you will listen to them. You can do every self-assessment in the book, but it won't necessarily move you towards change as much as that. So I think there's probably a lack of support structures for individuals going out into practice, both in dentistry and many other professions. But that's sort of one thing that really rises to the top with the kinds of experiences that trainees are undergoing right now.
Right. Can I add something to that? The CDA, I'm actually a member of the Lifelong Learning Task Force. And one of the things that we're looking at, of course, are mentorship opportunities. And not just for new grads, not just for dentists that have only been out for a few years, but those that are coming to internationally trained dentists that are, gaining licensure, and also for dentists throughout, their practicing life. So we are, we've opened the dialogue with several key stakeholders about what mentorship could look like across the country. And it's going to take on, a different look in each province. But I'm glad you brought that up, Dan, so thank you.
And Lesli, I think you had some commentary there, and I am just going to point out to people, we're just 3 minutes to 8 o'clock. Lesli, I'm going to let you speak, of course, and then we do have one more question, and I see a few things in chat. So we'll try, I'm just going to let our audience know, we'll try and have us out of here by 8:15, if that's okay. And so Lesli, I open the floor to you.
Sure. And I'll try and be quick. Answering this question, everything that Dan brought up and LouAnn brought up are great, especially for grads that, from LouAnn's perspective, from the national perspective, with that website, it helps those individuals that are not from the province. But if we take a look, speaking from Ontario, from an Ontario Dental Association perspective, I think, or just in general, when students are graduating, I look back 30 years ago when I was graduating, and as a dental professional entering the workforce, you have a little bit of a sense of confidence that's backed by your formal education and your techniques that you've developed. But this virus has put our entire dental profession, as well as the entire society, in a position of vulnerability. And there's a lot of unknown variables, and right from the start of the pandemic, which creates a sense of uneasiness and trepidation, especially for new grads looking for support and guidance, even from experienced clinicians. So in terms of mentorship, what Dan was saying, yeah, that's just, trying to develop something like that is a great resource. I would say to grads, try not to get too dismayed by the current circumstance. Yeah, it is difficult. It's confusing with their, unpredictability in our environment right now. But I think, all of us on this panel here who've been practicing for many years with experience, we do know that, everyone is going to have some rough patches throughout their career, whether it's professional or personal. And, we will overcome that, but reach out. You need to reach out to those around you that do have experience for guidance. And, one thing in schools, reach out to your instructors. They can help you. But from an ODA perspective, I strongly urge grads to look to the ODA for resources. The Canadian Dental Association has resources that are available nationally, but we have those resources that absolutely can help guide you transitioning from the role of a student to that of a practicing dentist. We've developed webinars specifically targeting new dentists. The ODA a few years back has developed what's called the New Dentist Symposium, which is available to dentists that have been practicing 10 years or less, and as well as dental students. And it's a great forum to interact. But unfortunately, last fall it was canceled due to the pandemic. But we have developed a lot of new products, services, and programs over the last year that can help new grads as well. Get in contact with if you're staying in Ontario, depending on the region where you are going to, the ODA has regional branches or arms of our association called component societies. These societies have meetings, continuing education events throughout the year, which are a great way to network, meet colleagues in your area, and have discussions with them, especially now, like I said, when everything is in flux. So again, going forward, mentorships, discussions, seeking resources from websites is great.
Thanks, Leslie. There's hope, right? I mean, I think that's the message I've heard tonight is the efforts of everyone on this call and many others. It's moving us in the right direction without question. And so I guess my last question really, until we get to the audience's questions, is what does recovery look like then in your minds? I leave this open. I'm not going to call on anyone. David, go for it. You're on mute still.
Yeah, I don't mind starting this one off then. I haven't talked for a little bit, so I promise not to take too long on that. Yeah. Because LouAnn and Dan and Leslie know me. I am an eternal optimist, and I think I am very encouraged by the future of our profession. I'm very encouraged by the future of this. This is challenging, but we've been through this before. We've been through I've practiced it, beginning through HIV. I've dealt with SARS. We've had all these sort of things, and they are completely challenging. And I think we always have to view these things with a little bit of humility. We don't know all the answers right now. But we have to have, and I think over the past year, we've demonstrated the ability to adapt and learn about new things. There's going to be some things that are going to stick around. I think I'm confident in saying we will not always have to practice in the current state of restrictions. I'm not the RCDSO, but I think that would be safe to say. But having said that, I think we have to be prepared to go there. We have to go there when we need to. There may be other challenges that are more serious than the current one that we have now. It's hard to imagine that. But again, don't forget, dentistry is a surgical profession, and we have to be able to deal with risk mitigation and infection control. And quite frankly, when it comes to infection control, this past year, there's been a significant drop in the number of colds, the number of flus. That has, without a doubt, that has not gone unnoticed on the public spending. So you've got the Occupational Safety and Health Administration in the States looking at ventilation and looking at air filtration system. So these things are here to stay, and for a good reason. And then there's the down-to-earth observational evidence that we look at from an individual perspective. I hate my gown. I can't wait to get rid of my gown, but I love my face shield. Okay, like we've all looked at our face shields, and I love my bonnet. Like, okay, that's sticking with me. My ears aren't so big when I see that. But there's certain things that I think we need to look at as embrace them, and they will be in a better place for that. So yeah, dentistry is going to look different, but I do firmly believe it's going to look better. And one thing that I'd love to close by saying is that, you know, we see a different approach, we see different guidance, we see different strategies through different jurisdictions, whether that be provincial or national or international. And it's very natural for us to sort of pick a side to say which one's right, which one's wrong. But I would just encourage people to look at that and say those different strategies, those different approaches are actually a good thing, because that's how we figure out what's the best way, not who's right, who's wrong, but what's the best way. And I think dentistry, we've been able to do that over the past year. We're in a far better place now than we were a year ago. And if we just use these same principles moving forward, we're always going to be ahead of the game, because we are ahead of the game. I'm very proud to be a dentist, and I'm very proud to be part of this profession.
I love David so much. You are such a positive guy. Okay, I want to hear from others, but only just final summary remarks, because we're after 8 and I have a handful of questions, but I think I'm going to ask one. And so, Dan, I see you chomping at the bit, so I'm going to.
Yeah, you know what? I'll be really fast then.
So
No, that's okay. I'm a systems person, and you know, as much as it sounds strange, I really am glad that I joined the RCDSO last August in the middle of this, because what better way, what better opportunity to meet all different parts of the system very quickly, and also to have to solve really complex and big problems together. And that's the only way that we actually change the system and move the system forward. So I'm an optimist like David, and I really look to lots of big challenges. I think about patient quality metrics, and it doesn't matter who's treating them in the dental office. There are a number of professions that surround their care, and how do we think about quality that matters to the patient? And you know, I think that translates then into other big problems like access to care, and probably many more. And so I really look forward to moving on from this, because we will, and also starting to really explore with all the system partners that I've had the great fortune to meet in the last 8 months, and really start to dig into some of these other issues that challenge the profession and the dental and oral healthcare system.
it's amazing. That's great, Dan, that you love a big problem. Well, you got handed one, that's for sure. So life is boring, actually, if you aren't unraveling something. So I think you stepped in something pretty juicy. LouAnn or Lesli, do you have anything you need to add to this?
No, if one thing, I'm gonna be, I'm like Dan, I love a challenge. So for me, coming on the CDA board at the time that I did, I found it very exciting. Yes, you know, there are a lot of things that are going on, a lot of challenges, but I think it's really moved us forward in a lot of ways in our collaboration, with whom we collaborate with. And I think that the COVID-19 pandemic has really created an environment that's ripe for change. And I think a lot of good things are going to come out of it. And, you know, we're going to move forward. And I think that dentistry is in a great position to, you know, be the leaders in, again, we can't rest on our laurels, I guess, but we've had no outbreaks. And I think we're really well positioned to be leaders in this respect for the healthcare realm.
And I'll just say one quick thing. I'm going to look at this. I'm going to give a different perspective. David gave us the perspective of the profession at large, but from an association's perspective, from the ODA, I think for us, recovery is going to sort of continue as like what LouAnn said in terms of enhancing relationships that we've built with, you know, other healthcare organizations, other stakeholders. So I can see the recovery phase from the ODA continuing to do that. And one of the big things I see, well, besides adding products, services, and programs that would help our members through the recovery phase in the initial parts of it. But I think where I see the ODA is returning to advocating for other pre-pandemic issues that have been put on the back burner throughout the pandemic. So from an association's perspective, that's where I see recovery.
Fantastic. And like I had said, I just feel it is, considering how difficult it has been, that the sense of optimism is welcome and it's lovely. And, same thing with when HIV came in, right? I mean, these are massive changes that people had to change and pivot and innovate and adapt. And we're in the same place here on a different scale. But it's been lovely just hearing from all of you. And again, I'm just being mindful of time. I'm going to ask one question because I actually think it's really an interesting one. And then some of the other questions, maybe what I'll do is I'll actually email them to you guys privately for responses, and then we can respond to people sort of offline. So the last question I would like to ask from our audience is, when is the profession going to start advocating for the environment and begin to introduce sustainability initiatives? And I think this really speaks to all of the new PPE things. At least it's something that we had heard. So I send that out to the group as our final question. Any of you can respond.
Well, I'll start from the ODA's perspective. We have been interacting with our neighbors to the east with Quebec and looking at some of the environmental initiatives that they've put in place. I will say, again, this is one of the things that I just said. When we start to get into that recovery phase, then we can, kind of look back and focus our attention to other issues that, have sort of, I don't want to say the environmental issues put on the back burner, but I guess the difficulty is when there's so much PPE that is required, infection prevention and control, things that we need to keep ourselves safe, that it's a daunting task to really, get that strong initiative for the environment going. But I can say, like, again, from an ODA's perspective, we have been working with other stakeholders on this. And I see David's hand up there to jump in and add to that.
Yeah, I will be very quick. And the best thing I can say is, the environment was being very important and we were working towards that pre-pandemic. But there's no such thing as business as usual in a crisis. And I know, Leslie, you said it was put on the back burner, but we have dealing with the crisis first of all. And this took everybody off guard. And it's not that we had to drop everything, but that a lot of the focus and a lot of the energies was translated into addressing this crisis. When this is all over, and whether this is gone or it becomes endemic, those other things will pick up. But it's hard to think of things in a crisis.
If I could just jump in as well, very quick thoughts. I'm running out of runway to say I'm new. I think I've been here 8 months, but I am new and I think I'm still learning quite a bit every day. And this whole issue of the environment and what the profession contributes to that and how we actually regroup on that, I think is a really important issue. I think one way that we can think about it as a regulator is when we are developing standards, we should be consulting with a variety of groups and perspectives to ensure that those standards are appropriate, protecting the public, and also do they meet some other needs. And I think the environment has to come out fairly high on that list of other needs. I don't have answers, but it goes back to my earlier comment about systems. Like, we're faced with a number of big, wicked problems, and no one organization owns them. So it really is, I think, critical that we figure out ways to come together and take the pieces that we can own as organizations and move it forward. But that's probably the best I can do this evening on that particular issue.
And I'll just add one last thing. I see some, collaborative effort here nationally as well as provincially. Certainly the CDA can, I'd like to see them again, when this is all over and all hands were on deck. We only have so many resources for sure. And it just took a lot to deal with the pandemic. But I see that there would be a good opportunity for us to get together with the provincial and territorial dental associations and tackle this together, lobbying our governments and Health Canada to come up with sustainable, solutions to this, because they are responsible for the approval of all these medical devices that we use. So,
yeah. I think it's a great point. And, as I'd mentioned, there are a number of other questions, but just it's our timing. I think we could be here until 10 o'clock if we all had all the time in the world. But Rochelle pointed out to me that it's actually Earth Day today. So what a great environmental sustainability question. And again, I thank you all so much for your time. I'm sorry that we've sort of run out of time and can't keep going, but I do want to thank all of you so much for this informative discussion and just sharing the evening with us. I know that really, at least for me, and I'm sure for our audience, that the information that you have shared has been very useful and really, really just so informative. I'd like to thank the audience, of course, and everybody who has joined us for your questions, and we will get back to those that we couldn't get to tonight, and appreciate so much you joining us. So I want you all just to stay healthy and safe until we're actually able to be in a room together, and thank you all again. Good night.